already, and I'll just check on the ones that will be coming up.
I'll start now, no?
Okay.
You can see the so as a beginning, I'd like to have a review of what is COVID, and the slide I'm going to present is with the kindness and kind permission of Dr. Andaya, no? She's so kind to share with us her PowerPoint, no? And
makikita ako? Hindi ako makikita.
Ate Nene.
Hold on lang, Dr. Tan. For all the participants, may I request that you mute all your microphones for the meantime?
Sorry.
Oh, kindly mute your microphones in the meantime. Thank you. Dr. Tan, go ahead. Thank you. Dr. Tan? Pati si Dr. Tan na-mute. Doc? Dr. Tan, go ahead. Hello, Dr. Tan.
Hello.
Hello, Doc. Go ahead.
So by definition, so we try to again review the old classification and the new classification. If you look at the old classification, it's a patient neither a person under monitoring nor under investigation. In other words, if somebody is not under investigation or under monitoring, then he must be a normal person. Okay? So the new classification is not non-COVID. So in other words, this is a normal person. Okay? And of course, this is the old classification is a PUM, that is a person under monitoring. So there's no such a classification. This is out already, And then the PUI, people under investigation, investigation, and whether they have the mild, moderate, or severe symptoms, and they're not tested, and waiting for the result, then we can say we are suspect, Well, later on we will talk about the signs and symptoms of COVID, In the meantime,
excuse?
Yes, yeah. Can
Doc,
you hear me?
Yes, we can hear you, but your slide is not showing.
Ganun ba?
Yeah.
You don't see? Okay, so I'll try to fix it. Sandali.
Okay.
Sandali.
Okay.
Do you see my slide? Meron na, wala pa?
Wala pa, Doc. Ayan.
Do you see it?
It's starting now. It's starting now.
Do you see
Not yet. Not yet po, Doc.
Not yet?
Not yet, Doc.
Jackson, can you talk to my son?
At Doc,
My
napuputol yung... Yan, yeah, it's there na, Doc. Meron na, Doc. It's okay na. It's out. Okay na, Doc. It's there. Okay na, Doc.
2 minutes.
Okay na, okay na.
I'll wait for a few minutes, huh? I'll fix it.
Ay, okay na, Doc. Ready na.
Wala pa, no? You don't.
Meron,
Ready na, kasi
meron na, Doc. Yes.
nakita niyo ba?
Yes, meron na.
Meron na, that's good. Okay, so we are our gratitude to Dr. Andaya for allowing us to use her slide. So let's talk about the classification. All classification, before we always heard of something which we call people who are not under investigation, not under monitoring, the new class case. So that's it. And then another classification in the old is the PUM, which is the person under monitoring, and the new classification, there's no more such a classification. So again, we go to the old one, then severe or no tested, or they're waiting for the results. Then, of course, with those suspected cases, so the new classification, we say they're suspicious. Okay. Severe includes and the test is again not severe state or with all the signs and symptoms of COVID, and they died, without the benefit of case of positive confirmed. So in other words, the new classification, we have the normal one, okay, current classification. Okay. Now let's go to the signs and symptoms. Okay, the influenza-like illness. Okay, of course they are just like the usual. Our, let's say 3 days of fever. Okay, has experienced this kind of acute respiratory infection, which we call SARI. Okay, earlier fever, breathing, and then they have also pneumonia, in X-ray. They may have to be admitted, they may have to be put under respirator.
Dr. Tan? Dr. Tan? I think Dr. Tan might be having a slow connection.
Yes. Can you hear me now? Can you hear me?
Yeah, but your slide has disappeared again.
Oh, okay. Okay, so okay, let me, I'm sorry, few more minutes, huh? I'll fix it.
Oh, okay, okay.
Sorry for the trouble.
It's okay. Let's also welcome Dr. Al Lagaya. He's already here with us. Dr. Al, good afternoon. Oh, Dr. John Villamayor. Good afternoon.
Good afternoon, sir.
This is the reality of going online. Our internet system in the Philippines is quite poor as of the meantime. So please bear with us.
Hello.
Yes.
Hi. Yes. Is the connection better?
Who is this, please?
Yeah. Sorry. This is Ando from Dr. Tan. Yeah.
Okay, yeah. It's
sorry.
better.
Sorry.
Now
sorry.
it's better. Okay.
Better. Yeah. Sorry.
Okay.
Sorry. Forgot to introduce myself.
Yeah, audio is better. Doc, how are you?
All right. I'm good. I'm good. Thank you.
Audio is better, but the video is not yet out.
A video wala pa?
The screen is not yet out.
Briefly, ano? And, si Doc Lagay is there, ano?
Yeah.
Dr. Jan, ano? Welcome, ano?
Good afternoon.
So a little review, ano? Did you see this slide earlier in my explanation earlier? This
Yes, sir.
one?
Yes, Doc.
So
This
I'm
has
not
already
going to-
appeared. Yeah.
So I think so. This is the one.
Mm-mm.
So we are also done with this influenza
Yes.
like. Okay. So a little. So now we go to those. Something. This one, no? We go to the suspect now, and then one of the classmates is a suspected case of COVID, no? Okay. Of course, the suspected one, those presenting with the following condition, they have this study, no? So that is to say, they have all cases of acute respiratory problem, no? If they have no, if they don't have this, they don't have this. If we cannot attribute them to other etiologies and other causes, then it's presumed to be COVID, or it is suspected. That's why we call it suspected. So if we have no other etiology, we have no other identifiable cause, then it is presumed to be COVID. So that's why we label it as suspect. Or if somebody has contact with persons with COVID, then it's suspected. So we have to undergo 14 days of quarantine. Okay. And of course, another is people who have these symptoms, age of 60, okay, with comorbidity or other illnesses like hypertension, diabetes, let's say renal failure. So these are people who are predisposed to COVID, with decreased immunity, okay. Of course, pregnant women, and also health workers, like the doctors, the nurses, all or those volunteers, they are presumed to have COVID, There's a saying we to presume everybody to have COVID, This is for us to be careful, Then another classification is probable, Of course, in probable, it's of course the suspicion, the level of the index of suspicion is higher than the suspected one, or the test is inconclusive, ano? Okay, or patient is tested to be positive, ano? However, they are not done in those authorized institutions of this test, ano? So they are presumed to be weak. Can you hear me? Can you hear me?
Yes, doc, we can hear you.
So it's unconfirmatory. So there are many patients who are suspected clinically to be COVID, but they didn't have the benefit of test, ano? Like probably they COVID. And of course, the confirmed one, those who are clinically picture of COVID, ano? Plus confirmatory test, ano? So that's those are confirmed cases, ano? So this is the this is this is the slide of patient with a fever, ano? And then with symptoms, ano? With symptoms of respiratory problem like upper respiratory problem, and even X-ray with X-ray findings, ano? However, this appears to be very mild, ano? This kind of cases at times they can be treated at home, and okay, or just isolation, ano? Okay, and for the probable, okay, initial findings and the following, they may improve, ano? Or no need to be admitted, okay. So these are the okay. So this is the step, the kind of algorithm for patients who have recovered. We would like to also test for their COVID test, until they are negative, so that we can be confident enough, to let them go home, or to let them have a normal life. And once they are discharged, or when they get well, they have to undergo 14 days of quarantine. Okay, and of course they have to undergo test again, until negative, until one we are confident. So this is a kind of flow chart of the course of COVID, and then of course for those asymptomatic, those who are tested maybe to be positive, or they're in contact with people with COVID, they have to undergo quarantine. For those symptomatic, mildly symptomatic, okay, they can stay at home or in a temporary shelter, okay, or home isolation. And of course, for those severe cases, of course, they have to be hospitalized, okay, okay, and so that's it. So now let's go to the WFAS per se now. Of course, we're very happy that the PTAC, is and working together with us, and we are going to adopt the guidelines of the World Federation of Acupuncture and MOXIBUSTION societies. Last week, Dr. Ryan, our very own Dr. Ryan Dalman, talked about the acupuncture points for those asymptomatic ones or the normal ones. But today we will be talking about the guidelines of WFAS, and we are going to treat those confirmed cases of COVID. Now we like to emphasize that still the main line of treatment of COVID is still the conventional Western medicine, and of course we want to make use of acupuncture as a supportive treatment. In China, they have a quite good experience with it, and they found that acupuncture has very good therapeutic results. Okay, so the objectives of the guidelines of the treatment will be to stimulate the qi, the vital qi, of the lungs, because in the spleen, the first organ being attacked by by COVID, and of course to the nose, and then to the respiratory pathway to the lungs, and of course the visceral organ. So the acupuncture is to vitalize the chi, okay, and to protect the visceral organs, like, as you know, the intestine is also being affected. Patients will present with diarrhea, etc. So we want to reduce damage, and also to prevent to retard the further propagation of the virus, okay, virus of the pathogen. And we want to enforce the earth to generate the metal, to stop the progression of the disease, okay, to lighten the mood, okay, and enhance the confidence. So you see, in acupuncture, we don't just treat the physical aspect of an individual, even the psychological well-being of a person is being tackled. And so it's a kind of holistic approach. And in the guidelines, there are three main groups of acupuncture points. The three, 1, 2, 3, 1, 2, 3. Okay. So let me see. So the first group, okay, the large intestine 1. These are the first group. I'm not going to mention, as you can see them, the group 2 and group 3. So these are the three main groups of the acupuncture that they are recommending in the guidelines. Okay. So in the mild or the maybe moderate case, each time we will choose 2 to 3 points from group 1 or 2. Okay, so we'll go to the points later. And for those severe cases, we select the points at the group 3. Okay, we select 2 to 3 points at group 3. Okay, so in the first thing is really to determine what is the stage, what is the how severe is the disease before we decide on the groups of the point. Okay, so for the light or moderate, we have these first 2 groups. Okay, so we get 2 to 3 points from these 2 groups. Okay, so let's go to each point. Okay, so one of the point is spleen, spleen 6. Okay, spleen 6. So as you can, if you look at this, the right leg. Okay, this is the right leg. This is the inner side of the ventral side. Okay, this is the malleolus. Okay, maybe fortune above this one. Fortune above, then that is the point. That is the point. This is the point. Okay. So this is the point that one of the point. Okay, in the main. Okay, and then with the large intestine 4. Large intestine 4. So this is the thumb and index finger. This area. Okay. This area. Again, this area. So large intestine, of course, will take care of the fever, okay? And also will boost the immunity of an individual. Okay. Of course, some of these patients may also have headache. So this is the large intestine 4. They take care of as I said, the COVID will also pass through the nostril. So by stimulating this point, we take care of the sinus. Okay. The cold-like symptoms, and also other bowel problems. Okay, so that's it. That's a large intestine. Then we go to liver 3, another point. Okay? The liver 3. This is the liver 3, and this is the big toe, and the next toe in between. So if you try to palpate this soft part until you reach the angle, this is the liver 3. Okay, of course, this point will improve the circulation of the chi. Okay, it is also an anti-stress point. It's good for the emotional energy. Okay, it's good for headache. So this is another point, and of course, there's another point. The CV22, the REN 22. Okay, this is a point. Good for the harsh voice. This is also affected by the COVID, the sore throat, and coughing. Okay, so these are the points. This point will be beneficial to these symptoms. Okay. Then another point is lung 6. Okay, the lung 6. No, this is the lung 6. No, okay. Okay, of course, this is the cubital area. Okay, or this area, the lung 6. No? Well, this is a point. It's a lung meridian. Okay, this is the point. No, the point here, lung 6. Huh? This is the cubital area. This is somewhere here, lung 6. Okay. So again, this is a point for respiratory system. Okay, and in the early slides, it is mentioned that the acupuncture point will not take care not only for the lungs, but also take care of the visceral organs. So the digestive system will also be taken care of by this lung 6. And of course, our emotion, the emotional component of the COVID will also be tackled by this point. Okay. And then we have the other points, no? The bladder, a lot of bladder points I can see here. Okay, bladder points in this area. Then we have lung 5. We have lung 5, no? Which is to enhance. Lung 5 is to enhance the immunity of the individual. Okay, and of course it also improves the lung function. And then see, so then we go to group 3. This is group 3, and then this is group 3. These are the points that we have to adapt for those severe cases, like those patients with severe pneumonia, difficulty of breathing, wherein they may have to be admitted in ICU. So these are the points that we have to make use of. This the lung, the CV, etc. You can look at this. Okay, the lung 1. Okay, this is the lung 1. Okay, this is for difficulty of breathing and cough. This is the one. Okay, in this area. Okay, for the lung function. Okay, for the lung function. Okay, okay, this. Wait a second. Oh, it's a repetition. Of this is another point. That's CV17. Okay, CV17 for the lung function. So first is we have to, based on the guideline, we have to determine whether it's mild or moderate or severe. So based on those the stages, then we select the 3 main acupuncture points. Acupuncture point. Then, of course, aside after determining those the main points, then we go to those matching points. Okay, go to matching points. Hello, sandali, just give me a few seconds. Sorry, so after choosing those points, then we have to look for the symptoms of the patient. We identify the different symptoms, and from these different symptoms, we have the corresponding points. Okay, so let's take them up one by one. Okay, so for those main symptoms with fever, okay, for those with fever, let's say patient with fever, okay, for patient with fever, these are the points. GB14, okay, GB14, okay, and then this one LI11, okay. These are the points. So the points is also for the fever and also for the ear. Okay, we try to fold the ear and then we look for the pointed part. These are the points that we can stimulate for fever. Okay, this one of course it's a bloodletting, fingertip bloodletting. And for those points, patient with chest tightness, or difficulty of breathing. Okay, chest tightness or difficulty of breathing. These are the points that we have to look into. Okay, the lungs 7. Okay, the pericardium. Okay, pericardium 6. The kidney 16. Okay, and the CV points. These are the different points. Okay, CV 14. These are the different. So these are the different points that we have to look into for the difficulty of breathing. Okay. Then again, we go to the patients with cough, matching points, if they have a severe cough. Okay, and these are the points. Okay, like this is stomach 14. No? This area, this is below, of course, below this, the famous stomach 36. Okay? So this point and the lung 7. Okay, and these are areas. Okay, these are the points, and these are the points that we can make use of for coughing and for those with a lot of phlegm. Okay, and then of course this one, of course, I'm sorry, this one is this one for those with diarrhea. Of course, this also affects the visceral organ, the diarrhea, loose stool. Okay, and this is stomach 25. Well, this is point. This is a point. This is a point above the umbilicus. Okay, I'm sorry, I have no picture above the umbilicus. Okay, maybe 2 tone above the umbilicus. Okay, and this is stomach 37. Of course, it's below the stomach 36. Okay, so we go to another one, cough and a lot of phlegm, and also with constipation. Again, we go to CV22. Okay, and the TE 6. Okay, these are the points for patients with cough. So then we go to another one with fever, vomiting, and stool. Later. And those with fever, vomiting, and then we offer pericardium 6. We go to pericardium 6. Okay, pericardium 6. Okay, we go to bladder points. So these are the points that we have to look into the bladder. Okay? In 36. So those are the points that we have to look into. Okay. So in other words, in the treatment, we first have to determine the different points. From the first 3 categories, for the mild and moderate, we look for the first 2 groups of my main point, get 2 to 3 points from the first 2 groups. And for the severe case, we go to 2 or 3 points from the third group. And then after getting those main points, we go to the matching points, depending on the symptoms with their corresponding points. Okay? And this is the one that you can see, let's say, in this one, the mild one, this the day one, usually the mild one. Okay, so we go to those. I think we go to the first. I would say you have to go to the first 2 groups. Okay, get chest good to go to the main 2 groups. Okay, get 2 points, and then we go to the matching point of fever. Okay, fever and those points with the diarrhea. Okay, like we go
Hello.
to this. Hello.
Hello.
Go to the stomach
Yes.
25. Hello. Can you hear me? Hello. Can you hear me?
Hi, Miss Agnes. Hi, Miss Agnes.
So go to the main points and the matching point. Okay. And this one, of course, the patient they have difficulty of breathing. We go to those points. Okay. And of course, this one with the severe pneumonia and PIPs in respiration, and for those severe cases. So I hope so. This ends my simple lecture. No? So if there are if there are questions, then maybe can entertain to share your maybe you may know more than I do, ano? We can discuss about it. Thank you. Jackson?
Hi, Dr. Tan.
I'm done.
Okay.
Did you hear
So,
me? Did you? So this
yeah,
this
we
is so
did.
weird. Okay. So
Okay.
I think we can have question and answer or sharing.
Okay. Thank you, Dr. Tan.
Yes.
To all the audience, if you have questions, I would suggest that we try to, it's a bit hard, but let's try to do it one by one. I can see hands being raised. I'll try to click on each one so you can, we can have your question. Miss LV Esquivel, go ahead.
Actually, Doc, later na lang kasi napindot ko lang yun kanina.
Okay. Oh, it's okay. It's okay. I'll go to
Thank
the next one,
you.
ha? Miss Margarita Lu. Do you have any
Kasi
question?
po, yung mga masyadong threatening nga yung COVID-19, bakit hindi i-suggest ng mga association ng acupuncturists na dapat mag-employ sila ng acupuncturist sa mga hospitals para ma-lessen yung burden ng mga mga patients at saka yung mga doctors no. Yung yung risk ng yung threatening ng life ganon, yung maraming namamatay ganon. Nakakatulong acupuncture, hindi ba?
Dr. Tan, would you like to?
Maybe, I think Dr. Lagay is there, no? Dr. Lagay, can you help us with this question? Dr. Lagaya?
Dr. Lagaya?
Yes.
Oh, yeah. Can you
Can
help
you hear
us
me?
with this question? Yes.
Can you hear me?
Yes,
Oh,
Dr.
yes, yes.
Lagaya,
Yeah.
go ahead.
Yes.
It's a very nice suggestion. Now we need really an acupuncturist to come in.
Yes, sir.
So
Yes, sir.
So what we're doing now is for us to work it out with PTAC, and then since may gastos yan, we would be needing funding for such. And the best way to justify that is to undergo a research that if PTAC would agree on the research, we will be doing a clinical trial, but for strategic purposes, we will not go for the severe cases. For the reason, two main reasons. One of it is we do not want to be in conflict with the internist, yung intensivist, yung mga nasa ICU. Kasi medyo ayaw nilang may gumugulo sa kanilang sistema.
Yes po. Yes
So
po. Opo. Nakakagalo ng system nila.
Yeah, gusto kong bawal na confine na yung pasyente. Ayan. Saka, the best strategy is as how acupuncturists were trained for, we go more for the prevention rather than for the treatment for the severe cases. The lecture of Dr. Ryan last time focused on, which is, you can also read sa binigay ni Dr. Cho Chiong, we focus on the suspected cases lamang.
Yes.
So if we PTAC would agree, they would agree on the funding, and we're working double time. There's a lot of team that is working on it. The next question would be, who do you think among the PAAI members would be willing to volunteer to be a clinician to do acupuncture to the suspected cases? Halimbawa, we want, ang importante sa research, close group eh. So hindi pwede mga home treatment. If ever we can identify a temporary facility that PTAC and DOH would be able to give us, then dun tayo pupunta. We were thinking of a 3-team approach, a team leader, and I'm going to be asking the PAI members, preferably doctor, mga CMA, preferably. Kasi nga, makikita kayo with the other medical practitioners. So, the team leader has to be a CMA.
Doctor. Yes.
Then, the team under the people, the staff under the team leader would be coming from you. So, if you would, basta ang condition natin, complete PPE, the initial discussion we are having is 1 week that you will be doing acupuncture, followed by 2 weeks of incubation or quarantine. So you're going to be working for 3 consecutive weeks. Then after the 2 weeks of incubation, you may handle again another case. So siguro matatapos tayo in 2 to 3 months doing that research. So I understand Dr. Oli already. Dr. Oli, how are you? I understand na una-una siya sa nag-volunteer. Kaso ang main issue, ayaw yatang palapitin ang mga 60-year-old and above. Kaya,
Hindi pwede.
baka pwedeng team leader, basta ang team leader will not be getting inside, not behind, but you will be in constant communication with the team under you. So if you're going to identify 3 teams, pwedeng isa, tapos on the remaining, let's say, kayo, whether you're a CA or a CMA, would be a part of the team. And we are, since it's going to be funded by PTAC, merong compensation. Kasi nga, unang-unang marami tayong trabaho ngayon na no work, no pay. Lalo na, karamihan naman sa inyo, no work, no pay, no? Hindi katulad ng iba dyan na no work since birth. Joke. So, since marami tayong no work, no pay, walang trabaho ngayon, and if we can shoot up the honorarium as high as we can, the team is working on it. So we have Miss Anna working on it. Dr. Cho Chiong is working on it. We have Dr. John Villamayor is also working on it. And we also have Dr. Christy Andaya working on this. So pag nabraso natin yan at meron tayong pondo coming from PTAC with all the honorarium, Dr. Cho Chiong will be asking you to volunteer to be part of the team. Now, pag interesado kayo, contact Dr. Cho Chiong, contact Letty to volunteer that you will be included in this clinical research trial. That's all.
Hi, Doc.
Thank you, Dr. Al, for sharing us, enlightening us about this issue. Okay. So, other questions?
Excuse me, can I speak po?
Go ahead.
I'm Dr. Rasulit. I'm actually an internist and working inside the ICU of St. Luke's Medical Center. I actually asked institution if we can incorporate acupuncture. However, yun po yung isa talagang malaking problem. If the institution will really allow us to, kasi me and one of my colleagues is actually an acupuncturist. Both of us are working inside the ICU. So, as an internal medicine intensivist. So, nandun na po talaga kami. Kaso hindi lang kami maka-intervene kasi yun po yung magiging isang problem natin if we wanted to do that in severe cases. Yung openness ng institution, if we can really incorporate that kind of treatment po. So, we are actually parang limited lang siguro sa outpatient.
Eh, ba't mo inalis nung ako yung nagmumura?
Huwag ka magmumura. Kasi naka-ano ako.
Dr. Thank you for sharing with us.
Miss Acuna, kindly mute your microphone.
I personally feel that the attending will... Can you hear me? Can you hear me?
Yes,
Can you hear me?
Yes, po.
Yeah, if you're one of the attendings or you're the main attending and you would like to do it, I see no reason.
Actually, that's the problem po kasi I'm actually an internist, hospitalist, parang ganon.
Are you the main attending?
No, that's the main problem. I'm not the main attending of the
You're at the
patient.
mercy
So
of
I'm
the
just
main attending.
right now po, it's a group practice. So if one
Will
member of the group will not allow, hindi po talaga. So we are really confined with working on just the outpatient. So yung mga severe po, medyo malabo siguro. Hindi
yun
natin
ang
yun
asahan,
ma-infiltrate.
Right. Well, as the
Sayang po
doctor,
sana kasi I think kung medyo marami pong internist na really inside working inside the ICU, maganda sana yun.
yun na nga, acupuncture is really a science, and it's even though it's being promoted, it's really being promoted by PITAC, and before it was spearheaded by Dr. Lagaya, and Dr. Jimmy Galveston. Well, we hope slowly it will gain acceptance. I think it's
yes, sir. Actually, on severe cases, if I have acute problems, what I do is just acupressure. So when I went inside, I would go inside the patients. Yeah, that's really what I do. It really helped me buy time, especially if, for example, po nagbi-VTAC yung patient, I just press something and then call attending physician before. So yeah, yun lang po yung kaya kong gawin to buy time para Anyway, pero hindi nila alam yun kasi ako lang yung nagpipindot po sa loob.
Dr. Tan Cho Chiong.
Thank you for sharing us. Yes,
Dr. Tan Cho Chiong, may I comment?
Yes.
Thank you, Dr. Rasulit. That's a very nice input. In fact, that is one of the main reasons why integrative medicine is having a hard time penetrating the incumbent healthcare system. And you've known that whether it's a cardiovascular case, whether it's a simple case of dengue, whether it's for low back pain, ang dami natin blocks. The strategy of this research, we will go for those na hindi nila pinapansin. And that is yung mga suspected cases na maring nako-confine sa World Trade Center, yung sinabi nila sa Ninoy Aquino Stadium. We're trying to, binabraso natin kung doon tayo pwedeng ipadala kasi hindi papapansinin yan. Ipapasa na lang sa intensivist only after gumrabi na ang case. So doon maraming blocks dyan. Kaya nga sana doon lang tayo. Now, that's one of the main reason why we wanted to be on the suspected probable cases lang. Ikalawa, since this is the first time that PITAC will be handling such a very dangerous scenario, we would like tayo yung pinaka-simpleng suspected probable cases lang. Ayaw natin isabak sa gera ang ating mga acupuncturists na nasa grabing state na ng sakit. So, let's pray for it. Bali, ang inaantay namin ni Dr. Tan Cho Chiong, who would like to volunteer to be the acupuncturist in this research team na dadalhin natin dun sa suspected and probable cases lamang, complete with the PPE facilities. Yan. Yun ang, we hope later, talk to Dr. Tan Cho Chiong and tell them you would like to volunteer to be part of it. Honorarium will be there, but please huwag niyo munang asahan. Pero siguradong binabraso namin yung honorarium na dumating. Kasi 3 weeks tayong mawalan ng trabaho from our usual thing that we do. That's all, Dr. Tan Cho Chiong.
Thank you for sharing. Okay. Thank you also, Dr. Sulit. Okay. We hope to meet you personally one day.
Yeah, sure.
Other question, yes.
Love you. Love it.
Thank you, Dr. Yeah.
Hello. Hello.
Yeah, hello.
Do we have other questions?
Yes.
Go ahead, Ms. So.
Okay, I'm Dr. Elizabeth So.
Doctora, yes.
Yeah. Actually, lately I have my co-resident. His husband is admitted in one of the hospital. His husband is admitted in the one of the hospital. Her husband is a cardiologist with positive of COVID. Can you hear me?
Yes, we can hear you. You can also open your video if you want.
Yeah. Okay. Her husband is a cardiologist admitted in one of the hospital. Her husband colleague, just like Dr. Hara, Dr. Magdo, Dr. Gray, all passed away. Okay. I don't have to mention the name of the doctors. It's a patient 358, okay, admitted in one of the hospital, and then they do Western medication. They gave alpha hydroxy chloroquine, acetylcholine, vitamin C, etc. And then when they call my boss, Dr. Iris Cho, who is now in Singapore, and then for herbs. for herbal. So Dr. Iris Cho called me. She gave me the formula for the Chinese herbs. So I went to her clinic to make the medication, 21 herbs to make into powder form. So we gave it to my colleague husband. So he tried it, and then at the same time, I advised him what to do, which acupressure point need to do. So it's thanks God, her husband is well at home, everything. So I think aside from acupressure or acupuncture, I think herbs, just like the herbal medication, Qing Fei Pai Tu Tang, or the other medicine, Wen Hua, Qing Un, can be given to the patient.
I think it's a very good testimony. I think Peter is also trying to study the 6 drugs being donated by China government to DOH. Okay, I think can you also enlighten us about this? I think there's also another group headed. I think Dr. Iris Teo is also part of that of the group.
Yeah, she's now in Singapore.
But he's also part of the team in studying this Chinese medicine being donated.
Yeah. She gave me the formula to make the powder form. Yeah.
Dr.
Yes, Dr. Cho Chiong. Thank you, Dr. So. The PTAC is also studying such. Pero alam naman natin, kapag internally taken, orally taken, doon talaga magre-react ang internist. They would claim it's interfering with whatever prescription they're doing. Unless it falls under the compassionate therapy that the patient would be willing to undergo, baka pumayag ang attending physician. Pero suntok sa buwan yan. Kaya, one of the best thing is, ang acupuncture, since theoretically it's a physical intervention, although there's energy into it, alam naman natin, it's the physical intervention na baka we can work with whatever medication the internist will be doing. Again, the research has to prove it. Kasi kung testimonial lang tayo, yun ang pinakamababa sa research evidence-based medicine. Ang testimonial, parang case study lang yan. Sinabi nung isang gumaling, why not? If you go for the next level, which is 10 pasyente ginamot mo at 10 gumaling o siya may gumaling, that's already going to be statistically significant. But if they go more with a control and a trial, which is part of the research that Dr. Andaya and the statisticians are trying to introduce, baka mas mabigat yung ating posisyon. If nagawa natin to, we'll go with the simplest level lang. Saka ang isang issue sa research, one modality lang. Pag pinagsabahan mo ng mararami, malilito ang research outcome. Kaya I agree with the Chinese herbs. Gawin natin yan sa ibang pasyente, pero dito sa research natin, acupuncture lang tayo. That's all, Dr. Cho Chiong.
Yeah, thank you, Dr. Al, for sharing with us. Okay.
Do we have other questions?
By the way, I think the drugs are donated by China is already with DOH, okay, and also maybe some of the drugs that are being mentioned by Dr. So, are available in also some of these drugstores in Chinatown. If some of them you will be in need, let us know. We can help you. Okay, help you channel them where to buy. Okay, of course, this is not this for use, for therapeutic use, not really for big business. Other question?
Are there any more questions?
One more question.
Okay, go ahead.
Yung pong salt therapy, like yung parang gumagawa ka ng vapor out of salt with boiling water, masyado hong effective po yata. Hindi kaya pwede rin hong i-suggest sa mga hospitals?
Yes, I think
Kasi masyadong effective yung salt eh. Sa India, ang ginagamot nila ngayon is mga lactobacilli at salt sa mga bata sa pedya. Yun po yung approach nila sa India. For ano?
I personally will agree with it, ano? But of course,
Yes,
we
sir.
cannot be too official with it, ano? There are some places are using this mga bawang, ano?
Yes, sir.
Bawang, ginger,
Luya.
Luya. I think these are home therapy, ano, which has been in practice for thousands of years, ano?
Yes.
So I see nothing. Can you listen to opinions from other colleagues of ours? Anna, I said is also a natural of Papa, no? How about is Dr. Jessica there? Dr. Jessica De Leon? She's in homeopathy, no? Anybody would like to share with us? I think there's no harm in doing it.
Yes, sir.
I think it could even be therapeutic.
Sir, if I may just add, if you would want really to do it inside the hospital, way to do it is to sign a waiver. If you are the patient or the patient's relative,
yes.
and you wanted to incorporate Chinese meds or yung mga salt, what you can do is to ask the hospital or your attending physician, and then the hospital will just give you a waiver so that parang whatever happens to the patient, parang ganun lang naman, sir, yung mangyayari dun eh. Yun actually, sa hospital where I work with, pagka may mga severe cases kami na ganyan, na pumapayag. Kaso, magsasign lang po ng waiver yung family. But if you would want that to be incorporated in the therapeutic regimen of the hospital, mukhang malabo po. So kung kunyari, meron po kayong pasyente na may COVID and you wanted to use herbal meds and Chinese meds, or you wanted to use mga salt na ganyan or herbs, you can do so. You just ask permission and ask for a waiver. Otherwise, yung kung sa ano po ng hospital, medyo mahirap po talaga natin yung ano. So pwede po yan, you can do it outpatient, or kung naka-admit po yung pasyente, paalam tayo sa hospital and dun sa attending physician po. Pwede po yun.
Thank you.
Are there any other questions?
Yeah, it's a very good point, a very practical point. Okay?
Yes.
Yeah, that's a usual thing that we encounter in hospital practice.
Dr. Villamayor has a comment here. Dr. Villamayor, would you like to tell everyone about it?
Usually, ang problem kasi dyan is yung in the aftermath, pag meron ng reklamo,
yes,
magkakaroon ng legal problems rin yan. Usually, yung hospitals ayaw nila yan. That's why you can only use it as a case-to-case pag magpapasign ng waiver at last resort. Pero pag last resort, yung mga severe cases, doon lang sila papayag. And sometimes yung doctor, pag medyo wala na talaga maibato yung doctors, papayag na din sila kasi ano doon. Pero severe na yun at saka wala na may ibigay. That cannot apply to us. That cannot apply to our study. That's why we want to avoid yung mga ganyan. Kasi ano yan hindi pa tayo ready sa mga ganyan. And marami pang controversies tayo may encounter with regards to sa ibang mga colleagues natin na medical doctors. So, with regards to the hospital, siguro we can bolster yung ating effect. Starting out with yung sinasabi ni Dr. Lagaya nga na, we start out muna dun sa mga milder symptoms. Kung may generate natin yung data na mas maganda yung makakatulong yung makaka-complement ng ating acupuncture and yung mas makakapasok tayo, makaka-penetrate tayo sa mga hospital cases.
One good thing is that even though as sinabi ni Dr. Sulit, her difficulty in her clinical practice, but I would say that it's the first time in the history of our country that the DOH under PTAC allow us to use a compassionate use of this herbal medicine. That's one thing, and also with a kind of endorsement by PTAC to use acupuncture following the guidelines of WFAS in this in the mild to moderate cases of COVID. So in a way, it becomes something official or quote unquote legal. So it's in a way, it's kind of a breakthrough in the movements of acupuncture and this year.
Thank you, Dr. Tan.
Are there other questions?
Are there any other questions?
Hello. Hello, good afternoon.
Yes, go ahead.
Hello.
Yes, go ahead.
I'm Nefay from Cebu.
Go ahead, Ms. Nefray.
Good afternoon to all doctors.
Yes, good afternoon. Yes.
Gusto ko lang po malaman kung for us who are private practitioner, like for example, if a PUI will ask our help or we are asked by some physician to assist them for those PUI kasi ayaw nila pumunta doon magpa-admit for those COVID-19 cases, what could be the what could be the repercussion if we accept those kind of cases as a practitioner? And then kung for example kunin namin yung case na yon, pumunta kami doon at inano namin yung patient, tapos nahawaan kami, what will be, kasi in we are working, some of us will become a frontliner. Magkakaroon po ba ng possibility na magkakaroon din tayo ng benefit katulad sa mga frontliner ngayon na meron silang, ang government will shoulder kung mamatay tayo, maging mahawa doon sa mga pasyente natin. Thank you.
Meron yan.
Yeah.
Who would like to answer the question? Dr. Tan? Dr. William Moyer?
Maybe Dr. John,
yes.
Yes.
I think there's a law based doon sa pronouncement ni President Duterte na those who are infected, lalo na mga health workers, may parang subsidy ang government to pay for the treatment, no? I think also para doon sa burial, but we try to, as a health worker, kailangan number one, identify yourself with either an organization or yung makakapag-tulong or makakapag-identify sa iyo na health worker ka talaga. And na para if something happens, ma-identify ka at saka ma-validate. Tayo naman as health workers, it is incumbent upon us to take care of ourselves. Yung talagang as much as possible, wag kang do all the necessary things na kailangan mo to protect yourself. Pero sometimes talaga nahahawa ka, kaya yun ang risk talaga natin as a health worker, as a frontliner. I think meron talagang support ang government with regards to that.
So the most important is really to be able to protect oneself before you go into the front line to help.
And then po siguro, before you volunteer in this kind of parang job or vocation, you really have to know, kasi hindi lang po basta yung susuotin yung PPE. There's really a protocol on how to properly don
proper procedure.
and how to properly doff out. Minsan, tama yung pagsuot mo, walang leak, pero nagkakalik when you take it out. So, yun po kasi yung chance kung paano ka magkakaroon ng COVID. When you take it out, yun yung mas risky kesa yung may leak yung suot mo during that time when you do the procedure. Kasi if you touch something that maybe meron pong COVID, tapos hawakan mo. So, yun po siguro, bago tayo proper training siguro sa mga gagawa ng magdodon at saka magdodoff. For the protection lang po ng acupuncturist siguro. And tama po yun. You have to identify yourself with a specific organization para at least may backup po na talagang healthcare worker yan.
Proper identification. Thank you for sharing, Dr. Sulit. Yes. Other points?
Dr. Tan Cho Chiong?
Yes. So I think, yes.
Dr. Tan Cho Chiong?
Yes.
Yeah. Dr. Sulit, could you help us do that kind of a demo sa isa sa mga lecture na i-discuss natin dito? Kasi lumalabas, this is already the second lecture. The first lecture was on suspected cases. The second lecture is proven positive na, and this is the lecture of Dr. Tan Cho Chiong. Dr. Tan Cho Chiong will assign a third speaker for those on the convalescent, yung gumaling na, and now for home therapy. Sa WFAS recommendation, meron yan. There's also a fourth lecture na gusto natin i-share and exactly yung sinasabi Dr. Sulit, how to don on and don off yung ating PPE. Tapos doon, a little bit of medical microbiology. Paano ba kumakalat ang infection? Ano ba sinasabi nilang airborne? Ano ba sinasabi nilang fomites? Bakit nakakahawa yun? Something for our PAAI member to be benefited from such. Kasi katulad ko, I'm already risking myself to go out kasi gano'n sabi pwede na mag-exercise. Pero pag may kasabay ako at alam ko yung hangin nung kasabay ko ay naglalakad at baka may COVID, lumilipat na ako sa kabilang kalye. So knowing that we learned that in medical microbiology, sana ma-share din natin para oras na nag-acupuncture tayo, titingnan din natin nasa bugad ng pasyente, yung hinga ng pasyente, nasa yung air draft kapag huminga to. Tapos syempre well protected at tapos hindi tayo marunong mag-alis ng PPE, di yung na-contaminate sa surface at nahawakan natin at kinuskus natin sa ilong, mako-contaminate din tayo. Sa tingin mo, Dr. Solit, through this video conference, you could help us share dito sa... sanay ka naman you've been doing it already sa hospital.
So, naging speaker ako bigla.
Second the motion.
Okay lang sa'yo.
Okay, Doctor, okay na? I second the motion.
Sige po.
Okay. So let's communicate with Dr. Sulit and to talk about. Doctor, do you have maybe you have to give me the guidelines. You have the article of the guidelines. Anyway, Leti will forward it to you. Okay. Let's be in touch. Okay. Thank you. Leti, can you? Leti will coordinate with you. Thank you. So shall we assign Doctora to take care of the fourth lecture? Okay? Sige na. Okay na, Doctora? Okay.
Okay, do we have other questions? Any other questions?
Dr. Tan Cho Chiong?
Oh, yes.
Meron tayong speaker for the third part, yung convalescent and home
the third will still maybe will be able to. Siguro in the next 2 days, we'll finalize it. Okay? The next 2 days. Okay. I'll talk with Doc Mike, kasi Doc Mike. Letty will finalize it by tomorrow, will be the next week. The Dr. Sulit, when is your timetable?
Wait, I will have to confirm po my schedule kasi nag-duty po ako sa ICU. So,
Not next week, the week after next week?
Yeah, sige po.
Tentative na. Thank you for your expertise.
Dr. Sulit, if I may ask, are you doing quarantine right now after duty? Are you required?
Yes po. Actually, the protocol of my institution is for 2 weeks ICU duty. So that would be every 3 days na 24 hours. And then mandatory 2 weeks off. But during the 2 weeks off, we're also mandated to do swabbing. Right after po the So actually, even if you're negative, you're still not allowed to go inside or work para lang po for safety purposes. Pero yung quarantine po na strict quarantine, hindi naman kasi negative naman po yung swab. We do that right after naman po the
Okay, thank you. We can take note of that para if we're going to be doing it later. Yeah. Okay, thank you, Ra. Thank you, Dr.
Are there other questions?
Are there any other questions from the other participants?
1 minute left, so we may be off immediately suddenly, no?
Wait, we have a bit of an extension. Any other questions from other participants? If there are no questions, I would just like to add something about the mention of the herbs kanina. We mentioned about using Chinese herbs. We know that it is accessible outside, but please all be reminded that these herbs are not supposed to be taken for all COVID patients. This is a reminder that came from the Chinese hospitals and the Chinese doctors also. It does not fit all patients. So there has to be a proper diagnosis that has to be done before the meds should be taken. Okay? Kasi some meds, all of us have studied Chinese medicine. Some meds are extremely cooling or cold, and it might not fit particular patients. Okay, that's just a reminder for all.
Thank you, Jackson. Jackson. By the way, Jackson is one of our board members, and also he's also a trainer ng INAM, trainer in acupuncture. Okay, so thank you, Jackson, for sharing with us.
Thank you.
So other points. So I think we're very happy. We have a lot of questions and feedback and sharing. It's a very lively session today.
Sir Jackson.
Yes. Go ahead, Miss Malu.
Ang question ko. Ang question ko lang sana, kung sasali ko dito sa research, may mga guidelines naman how to join, yung mga specific na ano yung magiging function or role ng bawat isa.
Meron po.
Na-develop naman na ganun. Sorry, hindi ako naka-attend first time.
Yes, actually, we'll be coming out with those guidelines later on. It's still under preparation right now. So this is just a parang overview pa lang, sneak preview na there is this thing that would be happening soon.
Including the age bracket ng mga sasali. Like for example, yung mga age na pwedeng sumali.
Age bracket, priority would of course be, as mentioned in Dr. Tan's lecture this afternoon, priority will be those that are not susceptible by nature. Meaning, yung mga masyadong bata or medyo may konting edad, i-exempt na po natin. Of course, medyo delikado po to talaga. So, we'll be trying to screen out yung mga mas susceptible.
Yeah.
Okay.
Okay.
Thank you.
Thank you.
So if there's none, we can end this one, We can end our talk,
Okay.
So thank you for sharing, Doc Al, Doc John,